All right, let's talk about the NCLEX. You know those hematology questions? They can feel just totally overwhelming. They're really designed to test if you can look past a fancy diagnosis and get straight to the life-threatening risk. So let's dive into this. I'm going to share a few core ideas that are seriously going to change how you see these questions forever. This right here is the first major shift in thinking. We're not just memorizing diseases, We're focused on the loss of function, protection from infection, protection from bleeding. When that's gone, that's exactly where your priority is. And this idea just builds right on top of that first one. Think about it. The bone marrow is the factory for our blood cells. So when that factory starts failing, either from the disease or the treatment, I promise you, every single priority question is going to be about the fallout from that failure. So here's the absolute bottom line. The NCLEX is a test of clinical judgment. It is not a trivia contest. It wants to know if you can spot the disaster that's about to happen, and more importantly, if you can act to stop it. That's the real key to passing. Okay, keeping all that in mind, let's take a little peek at how the exam coach's method takes these super complex disorders and turns them into a really clear system for making clinical decisions. So, let's be real. Why is this topic such a massive roadblock for so many people trying to pass this exam? Let's break down where everyone gets stuck. It pretty much always comes down to these four things. The names, leukemia, lymphoma, multiple myeloma, they just start to blend together. And candidates get caught up memorizing textbook definitions, but they can't connect them to the real-world crisis of bone marrow failure. Because of that, they completely miss the absolute top priorities, infection and bleeding, and they just can't spot a true oncologic emergency when it's staring them in the face in a question. And this really highlights the big disconnect. The NCLEX isn't asking you to just recite pathology from a book. No, it rewards your ability to recognize the deadly complications that come from it. That's the whole game. Okay, let's jump to our first condition and see how this all works in practice. We'll kick things off with leukemia. Instead of just a random jumble of facts, what we need is a framework to organize the chaos of all those abnormal white blood cells. So here's how we start to create some order. We begin by classifying leukemia on two different axes. What kind of cells involved? Is it lymphocytic or myelocytic? And how fast is it happening? Is it acute or chronic? This simple grid is your first step to actually telling these conditions apart, which is a make or break skill on the exam. All right, let's put this into action. You've got a patient with leukemia, they have a fever, and they're neutropenic, which means their infection-fighting white blood cells are dangerously low. What complication is just screaming at you from the chart? What is your immediate priority? This is exactly where our framework kicks in. Step 1 is instant recognition. Neutropenic fever is a full-blown medical emergency. It's a huge red flag for a potentially life-threatening infection. Now, inside the platform, we break down all the next crucial steps. But honestly, the most important part is this first one, recognizing you have an emergency on your hands. Let's move on to our next condition and see how this all builds. When it comes to lymphomas, the key is to look beyond just the obvious sign of a swollen lymph node and start to see the deeper clinical patterns. The NCLEX absolutely loves to test your ability to tell things apart. For lymphoma, the classic dividing line is whether or not these things called Reed-Sternberg cells are present. That means it's Hodgkin's. And this isn't just some random fact for a trivia night. It actually points to a disease that tends to spread in a more orderly, predictable way, and that has huge implications for treatment. See? This is how we organize the info so it actually sticks. So here's another quick clinical teaser for you. Your patient has enlarged lymph nodes and drenching night sweats. What pattern are you starting to see here? These aren't just random symptoms. They are classic B symptoms that point directly to lymphoma and tell you something more systemic is going on. Recognizing these patterns, that's a high-level nursing skill. All right, let's tackle our third major hematologic cancer, multiple myeloma. With this one, our focus immediately shifts to the absolutely devastating complications that happen when these abnormal plasma cells decide to attack the bone. This slide shows how we can take a really complex disease and turn it into a simple, logical story. It's really just a cascade of events. First, abnormal plasma cells take over the bone marrow. Then they produce this toxic protein. That process destroys the bone, which releases a flood of calcium into the blood. And finally, that combination of toxic protein and high calcium leads straight to kidney failure. You see the flow? It's all cause and effect. So when you see this exact clinical picture in an NCLEX question, bone pain, tons of infections, and a high calcium level, your brain should immediately jump to that cascade we just talked about. You're not just guessing anymore. You're recognizing a clear, dangerous pattern that points directly to multiple myeloma and its life-threatening complications. Now we get to the most important part. We've looked at these 3 diseases separately, but the real key to crushing it on the NCLEX is understanding how they're all connected by one single unifying principle. And here is that connection. It doesn't matter if we're talking about white blood cells in leukemia, lymphocytes in lymphoma, or plasma cells in myeloma. They are all cancers of the blood and immune systems. They are fundamentally related. So let's just quickly sum up the core problem of each. Leukemia, it completely messes up the blood cell factory. Lymphoma, it clogs up the entire lymphatic system. And multiple myeloma, it basically wages war on the skeleton and our immune system. But what do they all have in common? This right here, this is the big aha moment. This is the unifying framework. It doesn't matter which of these cancers you are facing in a question. If the bone marrow is compromised, your nursing priorities will always circle back to the risk of infection and the risk of bleeding. This is the master key that unlocks all of these questions. So this all brings us to the exam coach's advantage. It's not about forcing you to memorize more and more facts. It's about training your brain to think like a safe, effective nurse. It's all about training for clinical judgment. You know, our method is actually pretty simple, but it's incredibly powerful. We train you to recognize complications before they turn into catastrophes. We train you to prioritize what's going to kill the patient first. And ultimately, we train you to develop that safe, confident oncology nursing judgment that the NCLEX is built to test. And please, never forget this. At the end of the day, the right answer on the NCLEX is almost always the one that protects the patient first. Our entire system is built around that single, non-negotiable principle. So, what you've seen here has been just a quick glimpse into our approach, the complete in-depth hematology framework with every intervention and rationale you need for success, well, it's waiting for you right now inside the Exam Coach's platform.